Kia ora everyone, welcome to this video on the muscular compartments of the proximal lower limb. In this video we'll look at the gluteal compartment and also the anterior compartment of the thigh. We'll start with this lateral view of the gluteal region with all the muscles removed, and we see the gluteal surface of the alar of the ilium. And just draw in the sacrospinous ligament here and the large sacrotuberous ligament here. And these of course define the greater sciatic foramen here, and the lesser sciatic foramen here, which have formed with the ligaments from the greater and lesser sciatic notches. You might also recall that there are gluteal lines, a posterior gluteal line here, an anterior gluteal line, and a third inferior gluteal line here. And the gluteal muscles attach in relation to these lines. Gluteus maximus attaches behind and above the posterior gluteal line and onto the sacrotuberous ligament. Gluteus medius attaches between the anterior and posterior gluteal lines. And gluteus minimus attaches between the anterior and inferior gluteal lines. Gluteus minimus and medius both attach to the greater trochanter of the femur and are medial rotators of the thigh, attaching in front of the axis of the neck of the femur. And gluteus minimus is completely covered by gluteus medius. Gluteus maximus is partially attached to the gluteal tuberosity at the top of the linea aspera on the proximal posterior femoral shaft. So the deepest, most posterior fibers are attached there, about a quarter of the total fibers. The rest of the fibers are attached to the iliotibial tract, which is a thickening of the fascia lata, the circumferential deep fascia of the thigh. So we could draw the iliotibial tract starting here, derived from an encircling stocking of fascia, and the remaining fibers of gluteus maximus attaching into it. So gluteus maximus does not completely cover gluteus medius. There's a bit of gluteus medius that can be seen anterior to the anterior border of gluteus maximus. A fourth muscle is the tensor fascia lata, which attaches just in front of gluteus medius here. As its name suggests, it's a muscle that tenses the fascia lata, so it's attached also into the iliotibial tract. Four of these muscles are supplied by the gluteal nerves. The inferior gluteal nerve supplies gluteus maximus, and the superior gluteal nerve supplies the other three muscles, gluteus medius, minimus, and tensor fascia lata. And we'll see those nerves later on. Next we'll look at the deeper muscles in the gluteal region, starting with this more posterior view, again with all the gluteal muscles removed. Again, the sacrospinous and sacrotuberous ligaments, the greater sciatic foramen, lesser sciatic foramen. The most important muscle here, or the landmark muscle, is piriformis, whose proximal attachment is actually within the pelvis on the anterior surface of the sacrum, just lateral to the sacral foramina, and it emerges from the greater sciatic foramen and is a characteristic shape. It's pear-shaped, hence its name piriformis, and it attaches into the trochanteric fossa. It's also usually easily recognized, apart from by its shape, by the fact that the sciatic nerve either emerges through it or just inferior to it. And the sciatic nerve is very large and hard to miss, so it would look something like this. So in a dissection where the sciatic nerve is preserved, piriformis can usually easily be found. The other reasons that piriformis is considered a landmark muscle is because it gives the names to, or defines, the superior and inferior gluteal nerves. The superior gluteal nerve emerges superior to piriformis, and the inferior gluteal nerve emerges inferior to piriformis. There are other nerves that emerge inferior to piriformis. The sciatic nerve is one, but there is only really one that emerges superior to piriformis. And there are also vessels that accompany those nerves, so superior gluteal arteries and veins and inferior gluteal artery and vein. As mentioned before, the superior gluteal nerve supplies gluteus medius, which would be here, and tensor fascia lata, which would be here, and also gluteus minimus, which would be here. And the inferior gluteal nerve curls up and supplies gluteus maximus as it overlies this entire region. Below piriformis, emerging from the lesser sciatic foramen, is another muscle that originated or had its proximal attachment inside the pelvis, which is obturator internus. It comes from the internal surface of the obturator membrane and travels initially backwards towards us in this picture, and then sharply turns around and exits the pelvis through the lesser sciatic foramen to attach also into the trochanteric fossa region. This obturator internus. There's an obturator externus, which we'll see later. So this spills out of the lesser sciatic foramen, and it's flanked by two muscles that are twins. They are the superior and inferior gemelli, gemellus meaning one of twins, like Gemini. And these muscles start on the external pelvis, just above and below the lesser sciatic notch. So essentially the one above from the spine of the ischium and the one below on the superior part of the ischial tuberosity here, flanking obturator internus. And together these three muscles constitute the triceps coxae, or the triceps muscles of the hip. Finally, we have quadratus femoris, which is a quadrilateral shaped muscle. So it's not the quadriceps femoris, which is a group of four muscles of the anterior thigh, and it starts from a relatively broad origin because it's rectangular on the ischial tuberosity in front of the hamstring muscles, but obscured from our view here because we're looking from posteriorly, and it attaches to this area of the greater trochanter of the femur, which was again, it's fairly easily recognizable because unlike the other muscles which taper to their insertions, it has a broad proximal and distal insertion, so it's quadrilateral in shape, hence its name quadratus femoris. So here's an image with all of the muscles drawn in properly, except for gluteus maximus, so hopefully you can identify them now. And while we're here, we'll just revise those neurovascular bundles related to the piriformis muscle. Superior gluteal nerve, artery and vein. Inferior gluteal nerve, artery and vein. We'll draw in the sciatic nerve. The sciatic nerve descends down through the gluteal region to the hamstrings region where it passes behind the hamstrings muscles. In the posterior thigh, it can be revealed by drawing the hamstrings muscles apart, like drawing apart curtains. So that's pretty exciting. Another nerve that can be seen emerging from beneath piriformis, usually medial to the sciatic nerve, is the large posterior cutaneous nerve of the thigh, or posterior femoral cutaneous nerve. It's a surprisingly large cutaneous nerve. It's the largest cutaneous nerve in the body, responsible for innervating the largest area of skin of any cutaneous nerve. In the gluteal region, it has interesting recurrent branches that supply the area around the gluteal fold, and these are called the inferior cluneal nerves. Clunes, apparently, in Latin means buttocks or bum, and of course that makes us think of George Clooney's bum and how it caused controversy in the movie Solaris, where it was revealed and resulted in the movie getting an R rating, which was felt to be unfair and changed on appeal. The movie itself is based on a 1972 Soviet movie of nearly the same name, Solaris. Unfortunately, or perhaps fortunately, few people's sensibilities were offended by Mr. Clooney's clueness, because not many people went to see the movie. Also, somewhat predictably but very happily, there's a town in New South Wales called Clunes, or perhaps Clunes. I'm sure it's not the worst place in Australia, but it is just one more thing that our cobbers in the lucky country can be proud of. Bum. We'll look now at the muscles of the anterior compartment of the thigh. These tend to be either hip flexors or knee extensors. Some do both, and they're mostly supplied by the femoral nerve. The first muscle we'll look at is this most proximal, very large, juicy psoas major muscle. It's attached proximally to the sides and transverse processes of the 5 lumbar vertebrae, and also I think from the 12th thoracic vertebrae. and its fibers taper as they extend inferiorly through the pelvis towards the hip region, and they're joined by the fibers of this very large flat muscle, which is iliacus, which arises from the iliac fossa, or the pelvic surface of the alar of the ilium, and tapers to the same area. Here the combined fibers join and attach to the lesser trochanter of the femur posteriorly, about here, as the iliopsoas combination muscle, psoas major and iliacus. Together are very powerful hip flexors. Next we'll see this long strappy guy here, which is sartorius, the longest muscle in the human body. Sartorius is the tailor's muscle. To be sartorially splendid is to be well tailored, perhaps like these two folks here. And the reason sartorius is the tailor's muscle is that a shortened sartorius, contracted, tends to result in a flexed hip, a laterally rotated thigh, and a flexed knee, especially if the knee was already partially flexed. And this contributes to a cross-legged position, which is the position tailors traditionally sat in as they sewed garments. So sartorius, the tailor's muscle, its proximal attachment is the anterior superior iliac spine here, and its distal attachment way down here is an area of the proximal tibia anteriorly just medial to the tibial tuberosity. It doesn't have a nice compact name, that spot. Lastly, in this proximal group, we'll see pectineus, which is this characteristically quadrilateral shaped muscle here in the pubic region. Most of the other muscles in this area, as we'll see later, are triangular shaped, the adductor muscles. Its proximal attachment is the pecten pubis on the superior pubic ramus, and its distal attachment is the pectineal line, just inferior to the lesser trochanter on the posterior proximal femoral shaft. So pecten pubis to pectineal line, the muscle pectineus. It also has the distinction of being supplied by two nerves, both the femoral nerve, which is the nerve of the anterior compartment, and the obturator nerve, which is the nerve of the medial or adductor compartment. So pectineus has a foot in both camps, if you like, of those two compartments, a transitional muscle. I've also left in the picture here tensor fascia lata laterally, just to show that it's the most anterior of the gluteal muscles, easily seen when looking at the anterior thigh, and piriformis here, just to show its attachment proximally to the anterior part of the sacrum in the pelvis. For the remaining anterior thigh muscles, we have the four quadriceps femoris muscles, three of which we can see here. The fourth is deep to them, and we'll look at those in isolation. The longest and straightest of the quadriceps femoris group, and the only one that also crosses the hip joint, is this, which is rectus femoris, rectus meaning straight, and its proximal attachment is the anterior inferior iliac spine here, and also a small secondary attachment on the superior lip of the acetabulum, and its distal attachment is into the common quadriceps tendon here, which then passes through the patella and forms the patellar ligament, which attaches to the tibial tuberosity. Rectus femoris is flanked by vastus lateralis and vastus medialis. The fourth in the group is deep to rectus femoris, so we'll remove it to reveal vastus intermedius, which is sandwiched in between vastus lateralis and medialis deeply. Yeah. The proximal attachment of vastus intermedius is a substantial part of the anterior shaft of the femur. So if we remove vastus intermedius, we could see that it would have been attached along here. And because it takes up so much of the anterior femoral shaft, it doesn't leave room for its brothers vastus medialis and lateralis to attach here. So they are forced to attach posteriorly to the medial and lateral lips of the linea aspera. This small muscle revealed here is articularis genu, which is a muscle that tugs on the synovial membrane of the knee joint, which isn't much of a job description, but it's probably important. Vastus lateralis has a small anterior attachment here on the greater trochanter, and vastus medialis has a small attachment here just below the intertrochanteric line, or at the inferior limit of it. If we look at a posterior view, we can see that the attachment of vastus medialis coming down from this intertrochanteric line here spirals around the proximal shaft, and this is the spiral line, and then it becomes continuous with the medial lip of the linea aspera. So that's the proximal attachment of vastus medialis. Vastus lateralis continued down on the lateral lip of the linea aspera. These attachments are via aponeurotic type fibers that feed into those lips. Iliopsoas would be attaching here, the lesser trochanter, and pectineus would be attaching here, the pectineal line. The minority of the fibers of gluteus maximus would be attaching here into the gluteal tuberosity, which also merges with the lateral lip of the linea aspera. And again, these lines can be confusing, but you can find your way with G for gluteal tuberosity, P for pectineal line, and S for spiral line. So GPS to help find your way if you're walking backwards. Time, of course, for some athletic surface anatomy. This is the late great Peter Snell, New Zealand's greatest middle distance runner, won 3 Olympic gold medals. In this photo, he's setting a new world record for the mile in Whanganui. Obviously a very prominent sartorius muscle here. This is vastus medialis. This will be rectus femoris, and vastus lateralis will be over here, somewhat out of shot. Very powerful legs for a powerful guy. More sartorial splendor here, but sartorius splendor here. Obviously sartorius looking very rectus-y here, quite straight. But this is rectus femoris. This is vastus lateralis and vastus medialis. Unfortunately, when we look at pictures of the boys and their thigh development, it just seems a bit crazy. And the trouble here is that the bonkers overdevelopment tends to obscure the individual muscular anatomy, which is why the great man on the right here always wins, because he understands that it's not all about mass, but also proportion, definition, and balance, particularly the right balance of anabolic steroids. But it was a different time, and he knows now that it was naughty. For surface anatomy in the deep gluteal region, we'll probably have to turn to the Sanghelian, who doesn't seem to have a gluteus maximus. This could well be their version of piriformis. Of course, in humans, everything is rather disappointingly covered up by gluteus maximus and a whole bunch of subcutaneous fat. So we're left with disappointing images to consider, such as this, and this. And of course this. That's almost everything you need to know about the gluteal and anterior thigh regions. Next time we'll look at the medial and posterior compartments of the thigh. Until then, here's some more sartorial splendor. Ka kite.